Next, we have a post-operative glass prescription and selection. Happiness for the surgeon and patient. Dr. Shivan was supposed to be here, but he's been represented by Dr.
PRIVILA.
PRIVILA. Go ahead.
Good evening, all. Today, I'm making this presentation on behalf of Dr. Shivan, our medical director. The topic is post-operative glass prescription and selection, happiness for the surgeon and patient. Even though this topic has some business aspect, I have no financial interest. This topic is being discussed under these headings. All through these years, we have seen improvements in cataract surgery outcomes. This has in turn increased patient expectation regarding postoperative visual acuity. But then, refractive errors after cataract surgery are relatively common and that impacts patient satisfaction. These are the indication for spectacles after cataract surgery. Research states that on an average, more than 50% of patients wear spectacle after cataract surgery. And we have noticed all these changing trends that more than 50% of population change their glasses in 1 to 3 year period, and this in turn increases the patient turnover. Spectacle-free cataract surgeries are actually very less. Few patients with high-power glasses, they wait for cataract surgery to avoid their glasses forever. When the patient hates using glasses, all these patients may insist for a spectacle-free cataract surgery. But are they all really happy? Can surgeon make them really spectacle-free after IOL surgeries? This requires best patient selection, best counseling. We have to understand the patient's expectation and explain the limitations. We have to tell the patient that they can't expect 100% distant and near vision. For that, accurate biometry is a must and the patient should be free from retinal and corneal comorbidities. Coming to the disadvantages of multifocal lenses. They are very expensive and implanting a multifocal IOL can lead on to reduced light intensity, reduce contrast sensitivity, increase in glare and halos. Even the new generation multifocal IOLs, they are not free from devoid of glare and halos. So, it is not very suitable for patients with heavy dependence on night vision, intermediate vision or specific job requirements like commercial pilots and drivers. Next slide is actually explains an important aspect of this presentation. So, I'll be explaining it by showing you two different scenarios which usually happens in our hospital. Here you see a happy doctor and a happy patient. He underwent multifocal IOL implantation from our hospital. Then he goes back and started experiencing glare and halos. He comes back, questions the doctor, raises his concern, then this goes on and on. Then the patient gets irritated, the doctor also gets irritated. Then the patient is not getting convinced, so he goes for doctor shopping and then we never know where he lands up. Maybe he comes back to you or else he visits some other centers. But in the end, maybe you are getting a unhappy or not satisfied patient. See this. This patient actually underwent monofocal IOL implantation from our hospital. Then we have an in-house optical store. He went there and got himself an advanced progressive lens. Then he comes for IOL. Then he comes for post-op follow-up visit and visits opticals maybe every 3 or 5 years. And this provides a continuous source of income or steady source of income for the hospital. So, here you can see the doctor is also happy and the patient is also happy. I assert I have nothing against multifocal IOLs, but here the clear winner is monofocal IOL implantation and giving glass correction later. Then coming to the spectacle selection after cataract surgeries. Selection as per the need of patient is very important. Plastic lenses are more popular these days because they are thin and lightweight. These are the three basic type of lenses which we give to the patients. I'm not going into details. So here you can see the progressive lens and the advanced progressive lens with very minimal peripheral distortion and that provides wider distance, intermediate and near fields. These are the different tinted and protective coatings that you give. The anti-reflective coating eliminates annoying reflections from the anterior and posterior surface of the lens. It provides better vision for reading, computer use, and driving. Blue light reduction coating is very popular these days because exposure to blue light without proper eye protection can cause serious long-term eye damage. It is mostly beneficial for people working on computers. Tints actually come in and out of style all the time. In addition to enhancing your looks, it serves various purposes. It protects against UV radiation, reduce contrast, and improve glare. Photochromatic lenses immediately become dark shaded when exposed to sunlight. Anti-fog coating helps in eliminating the fogging effect. Scratch-resistant coating can play a significant role in preventing scratches from damaging your lens. Thus, they help the lens to withstand the wear and tear of everyday use. Polarized coating reduce glare and provide UV protection. Here you can see that the light rays getting reflected from the surface is being filtered by the polarized coating. UV coating is used for protective purposes, mostly used in pseudophakic patients. The normal coating transmits 5%, whereas the best quality UV coating transmits only 2% of UV rays. Gradient lenses help to protect your eyes from overhead sunlight tinted from top to bottom. They are especially beneficial when driving to see the road and your dashboard better. So actually, you should be able to assess what is the need of the patient depending upon the affordability of the patient. For that, you should have an efficient operational team. The optical in charge must have a thorough knowledge about all types of glasses and frames. Up-to-date knowledge about the latest trends is essential, and a senior optometrist trained in optical is ideal. Take-home messages: assess, categorize, understand the need of the patient, educate the patient about high-end frames and glasses, focus on the need of the patient's accuracy after service. I'm sorry. Here again, you can see two sets of patients. The first patient is wearing glasses and he looks happy. The doctor also looks happy. In the second set, you can see the patient is happy and she says, I see so much better now after cataract surgery. But the doctor doesn't seem to be happy. Maybe she underwent multifocal IOL implantation and the doctor is being scared and he's thinking about all the other complications that may come later. Thank you.
Thank you, Dr. PRIVILA, for covering this vast topic in 7-8 minutes. The essence is that you promise less and deliver more, then the patient will be happy.